Assalamu alaikum. Thank you very much for this introduction. I don't know, what did you leave? What did you pick? What did you get information? Dr. Hadi, I think I'll have a talk with you after we finish. Well, first of all, thank you very much. And I would like to thank the Malaysian National Cancer Society for inviting us at this beautiful university. And I would love to talk about so many things. Unfortunately, my presentation is quite different, although I might later on just make a few comments on what our colleague from UICC has presented. So, this right or left? This, okay. So they wanted us to, or wanted me to talk about how we have changed or put our print for cancer treatment, cancer awareness in the state of Qatar. Of course, this is a timeline of the presentation, but this is a very important thing or a very important slide. The Qatar Cancer Society actually was a committee of many ministries and organizations. And in 1997, we had so many difficulties in the sense that I was chairing that committee, but I cannot make a decision because everybody has to go back to their respective ministries and take permission, and it will take so much longer time. So I went to His Highness the Emir and I said, you want to help cancer patients in Qatar? You want to improve deliveries of cancer services? We need to have an NGO. So we were established in 1997, and since then we've been a leader in that part of the world. We are the only society which is a part of the national strategy. So the Qatar Cancer Framework is, we are part of it. We sit on all the committees, we sit on all the boards. All my staff participate in all the decisions that have been made in the country and in putting the 2030 cancer strategy for Qatar. As our dear colleague, I forgot your name. Felicia said, I was the president of the Gulf Union Against Cancer for nearly 20 years. And Gulf Union Against Cancer reminds me of UICC, started very prestigious, very nice, but then it started going down. We are also a member of the UICC, as I said, and I'm the partner of crime with Dr. Wahid Al-Kharousi in setting up the ICPC, the International Cancer Prevention Consortium, which is definitely a consortium that helping underprivileged countries. We all think about having fancy places, fancy cancer centers, fancy machines, with all due respect to my oncology friends, physicians, surgeons, whatever it is. But we always forget about awareness. We forget about how to reduce the onset of cancer, how to improve the quality of life. So we came up with, Dr. Wahid talked me into it. It took him one lunch to convince me of doing it. So we're working with international institutions, and I will leave this for him to talk about it when his time comes. But definitely, we need to focus on awareness. It's our vision and mission. As we said, our vision is Cancer Awareness Society and help support patients. Now, these are the dimensions that we want to work on, which is the beneficiaries, the supporters, the partners. And I want to apologize. This slide was created by Dr. Hadi and his colleague, and it's a puzzle. For me to understand it, honestly, it's a puzzle, because now you will see. So there are 4 pillars that we need to focus on. One of them is excellence and innovation. The other one is the partnership, and then advocacy, and then the 4th one is sustainability. All this, still the slide is not finished. So what's the ultimate goal of having these dimensions and these pillars is to get sustainable growth for Qatar Cancer Society, and number 2, increase the results for the patients and for the prevention, and on all the aspects that we were talking about. So we focused on two elements. One of them is social development. We talk about health awareness. We talk about care and support. We talk about research and innovation. And the other one is the human development, community empowerment, and cooperation with partners. So again, another puzzle by Dr. Hadi. So these are our partners. When we talk about governmental institutions, we talk about regional partnerships, civil societies, NGOs, institutions, private sector, and mainly is to get funding, get resources in order for them to deliver, and all under one umbrella or under one, again, Dr. Hadi, that's another puzzle. These are the elements, as I said, we are part of the National Cancer Strategy. And all these publications that have been done in cooperation with Qatar Cancer Society, and I'm proud of my team that they've done this work. And, focusing on education, on everything, and treatment, all the way to the This is part of the collaboration that we do. If we talk about the Ministry of Public Health, we talk about a much higher level on the policy, on ethic activity. It was very important, and that's what we advocate for, and that's what we push for at Qatar Cancer Society. And then when we look at the socioeconomic cancer, the data, we exchange data with the Ministry of Health and other places because we are very approachable as Qatar Cancer Society. But put this aside, we've put a model here or numbers, and this is during COVID. We had 0 services at one point, and then we realized that we had to go into the digital dimension and access people. So you see the numbers. 2020, we had around 111,000 direct contacts, and when we say that online, and that includes physicians, includes patients, includes students. And then 2021, we went to 462,000. So sitting back and realizing that we can have a better access, easier to people, you see the jump that we have created in 2022, 2023. 4 million plus and 3,900,000. And that's one-to-one access. And when we say one-to-one, we'll have our physicians sitting with patients, sitting with the students, sitting with educators, sitting with other physicians and healthcare providers in delivering all these services. Another dimension is when we work with Hamad Medical Corporation. And Hamad Medical Corporation, for those who don't know, the Ministry of Public Health does not run hospitals. They own them, but then they have these corporates that run the hospital, and Hamad Medical Corporation is the one that run all the hospitals in the country under one corporation because of rules and regulations. But if you look at the number of patients, these are beneficiaries of Qatar Cancer Society. In Qatar, the Qataris are taken care of when it comes to all services, healthcare, free of charge. But for the non-Qataris, everything is covered except for oncology and dentistry. So here where Qatar Cancer Society comes in, and we pay all expenses of all residents of Qatar and sometimes certain visitors with certain exceptions. So you see the numbers in the last 10 years, how many patients we are supporting. And this is a huge burden. Again, Sidra medicine is only concerned with children and on cancer of children. Dr. Hadi, I think you have a mistake here, because 2023 is 5.1 million, not 3.5. I signed the check, so I know the numbers. So you see how much money we spend, and Qatar Cancer Society is not subsidized. It's not supported by the government. We are an NGO. We solicit and we create our own programs to raise funding. And we spend a lot of money on patients, and as I said, all of them are non-Qatari patients, and that's what we focus on doing. Sorry. Yeah. Oops, we need to go back. Primary healthcare. Primary healthcare is the organization that has all the health centers in Qatar, all over Qatar. They run all the health centers. and we work with them in so many different dimensions. But again, I wanted to focus that at the beneficiaries, look at the numbers that we have created. We have pushed and pushed and pushed. The past 20 odd years is an uphill battle, and we will continue. But two important programs that we are building with the primary care. One of them is the HPV vaccination. And we are pushing that in a very, very strong way into schools, so, all over the country. Universities, we have done a lot of programs, and Dr. Hadi can talk later on about these programs. And the other one is the continuous professional development. I forgot to mention earlier that Qatar Cancer Society has the only awareness center. We call it Qatar Cancer Awareness. I wanted to call it academy, but it is to have an academy. Though we use the we all programs have been given great. We do have a full year program. There is no single month that we don't have activities. So we build up the capacity with our partners. And these are the major partners that we work with, from the Ministry of Health, Hamad, Primary Care, Sidra, and the National Cancer Program. So we set the tone for them. Whenever they slow down, we push them up. Whenever they want to go faster than us, we bring them back. So we control that, but it took us more than 25 years to get to that stage. We have a program, this is called Success in Your Health. It's focused on school children. They spend a day or two with us. They go through a lot of training. One of them is the Healthy Kitchen. But the Healthy Kitchen is not only focused on children. It's all age groups at different times, different programs. We have the Women Cancer Awareness, which is only for women. These are all done at the center itself. They have their own programs, they have their own timings, they run it the way they feel, and we have a lot of cancer survivors. This is a program we've done last year, and it's a very successful program for tobacco cessation or anti-smoking program. We've asked families to help their children in creating a short video, and the video that comes with the best idea wins. So we made everybody a winner. And the main thing was to have the family participate. So it's not the students or the child. The whole idea was to have the family participate and understand what do we mean by cancer awareness. And if we men are very selfish, how many of us go home every day and teach our children? We don't. Honestly, I want to be nice to the ladies. So women are mothers, they are sisters. These are the teachers, these are the educators. All of us were brought up by women. So it's not the father that teaches you every day, it's the mother. So we focused on women and in pushing families to participate. And since we moved, this is part of our application, which is, we had successful or a very successful run with it, and it is still one of the most successful programs because people have the privacy of contacting and asking questions, learning about cancer. It's still a taboo. Dr. Rabi was talking about that. It is still a taboo, although I've seen many things happen to me. A long time ago, I was on the radio and somebody calls, it was live interview, and he says, "Can you get it?" So I said, "I have a better idea for you, switch the station." We had times where people don't even want to talk about it. Oh, that thing. Oh, that thing. It's not. I mean, we broke that stage, but we still. So the application have helped us a lot in passing that stage, and we hope we can get cancer patients. He spent a day in our kitchen. I can proudly say it. Not only Beckham, Messi, he had to visit all the cancer patients our children who are undergoing treatment, him and Paris Saint-Germain. That shows you how we play a bigger role in the whole stage in Qatar. We managed with FIFA to secure tickets for children survivors to attend the games. So we have a lot of access, and we try to be very smooth. I learned from my mentor, Dr. Wahid, how to be a smooth operator. So, no, honestly, we've come a long way. We've had, I make it look like it's simple. It's not simple. It's really been a very disastrous period of time for us to get to this stage. We've had a lot of fights. We've had a lot of issues. We've had a lot of financial difficulties. But we got to a stage where we invested heavily for the Qatar Cancer Society. We have, our own properties that bring some revenues to the society, and we have our own way of raising funds. This is a program we had for the children with an astronaut from NASA. So we pulled every string we can pull, we did. We did not leave any stone unturned. Also, media. Media plays a bigger role. And this is, of course, as everybody knows, is Al Jazeera. Al Jazeera is one of our media outlets that we utilize. They help, they accommodate cancer patients, they accommodate our educators, they accommodate our board members, some of our visitors who come. So there is always something regarding cancer on Al Jazeera anytime. And this is a book that we published with Cornell Medical School, which is also, it's story of hope. We talk about different stories of patients and some researchers. And I think, Dr. Hadi, if we can secure some for our colleagues here, it will be nice. When we go back, we can send it to them, and we'll be proud. If you can send some money, I'll be happy, but, I can accept Visa, MasterCard, guys. Anybody? Now, this is something we launched a few weeks ago. It's called Wayakum. It's an application. It's only geared for patients of cancer. In the past, anybody who would like to those who apply for financial aid, first of all, we don't hand out money to any patient. We pay the hospitals directly after reviewing the program. So in the past, you'd have to submit paperwork, and everything has to be on paper, and it will take nearly 48 hours, sometimes 72 hours to approve. Now everything is being done online and through the application. The average time is about 12 to 16 hours. We are heading to 2 hours maximum to get approvals, because there are only 2 centers that provide the service. We need a new report from them and certain questions regarding the patient itself. So I was told by Dr. Hadi that we have reached about 42 to 45% of the patients. We have nearly 1,300 patients that are diagnosed, newly diagnosed, and undergoing treatment. Our only problem is in maintaining what happens to these patients, because a lot of them, some of them start treatment in Qatar and they go back to the respective countries. Some of them finish treatment and then go back to the respective countries. So that data we lose. We cannot analyze. We don't know, what's the life expectancy. We focus on a lot of scientific programs. Our average in every conference is about 3,000 plus people, which is very important. This is one of the programs that I like. These are oncology professionals, nursing and providers. They come for their chemotherapy courses at our training center, and they get certified from us. So Dr. Hadi and his group, thank you very much for whatever you do. This is the city challenge that we have hosted last year. And of course, these are our members. And sorry, Malaysian Cancer Society, you came last year because we've added this recently, and we'd love to have more than that. And I want to thank you for everything. I hope this is the future that we're looking for, having a holistic approach for the cancer programs in Qatar and the region. Of course, everybody is jumping on the artificial intelligence wagon, so we're not going to be left behind. And also finding, funding for research for cancer. This is the criminal group that I work with. And I want to thank everybody for giving us the opportunity. I think this is the last slide. Yeah.
Thank you very much, Dr. Khalid, for giving such a lovely talk into the fantastic work done at the Qatar Cancer Society.
Where did you find this photo? This is way too back, This
is the prowess of the National Cancer Society in Malaysia. So, thanks to your talk, we also saw which activities inspire the greatest response from the crowd. So, hint, hint, wing, wing, National Cancer Society Malaysia. Maybe should we see some star football players very soon?
I will give a prize for anybody who doesn't ask a question.
Right. So,
Now, if I may comment on our colleague from the UICC, honestly, I think he has done a great presentation, but he was presenting like he's running for office, and everything is rosy. No, everything is not rosy. UICC has a lot of nice programs, but nothing is implemented on the ground. UICC, if you want to ask them anything, you have to pay, and you have to pay dearly and very expensively. What we are trying to do at ICPC is to train people. If Oman Cancer Society and Qatar Cancer Society, with their limited budgets, can get people from underprivileged countries and train them, that's the most important thing. My goal is to reduce the onset of cancer. I don't want to have the best cancer center. So what? My mortality and morbidity is not going to be the numbers that I want. But if I can prevent, if I can educate, if I can teach people, and that's where I differ with UICC. We are part of, we participate with UICC, they are one of our partners, but at the same time, they're sitting in their own crystal maze and they don't want to come down. When you talk about Africa, when you talk about, how can you go to countries who have no money and you ask them to implement a program? And instead, you train their young people, you train their physicians, you accept them. How many scholarships did UICC give? With all the money that they make, 90 years, I know their bank account, how much in their bank account. If you want me, I can say the numbers, but I'm not here to. But no, honestly, I disagree on the whole concept of having programs and the World Summit leaders. Okay, I was in Mexico 2017, me and Dr. Wahid and other colleagues, we attended the Leaders Summit. What did they achieve in Mexico? Zero. You were there. Zero, honestly. So it's about time that we go down and educate people and tell them how to do basic things. Reduce the onset of cancer is far more better than treating cancer.
So, since we are deviating a little bit from...
No, we're not deviating. I just, I have to say it.
I mean, from the time.
Yeah.
So unfortunately, in spite of the promise of a prize for each person who asks a question, I have to limit the number of questions to 2 from the audience.
Sure.
So hands shooting up over here. Tamila?
Assalamu alaikum warahmatullahi.
Alaikum salam warahmatullahi.
I'm Hamid Jan from University of Science Malaysia. Thank you for the interesting presentation and congratulations for the success in leading Qatar Cancer Society. For the past 10 years, I've been working with 2 types of cancer patients, breast cancer and colon cancer. From my experience doing research with them, I found that 2 issues is first, delayed detection, late detection, and delayed treatment. I think these are the 2 big factors that affected their success rate in terms of mortality. Just want to learn from you that in your country, do you face a similar problem? And if yes, how do you overcome that? Thank you.
Well, thank you very much. A very important question. We did. We used to face this problem. And then we about 5-6 years ago, for example, the colon cancer, we started that program. And funny enough, I was part of the launching the program, and 5 or 6 days later, I received a call, and this lady is telling me, you need to go and do, your colon testing. And I said, do you know who I am? She said, no, I don't care. You have to. I said, I am the one who initiated the program. I am the one who launched the program, and I've done the test. She said, no, I see on the system, no results for you. So you have to go and do the program. So we did push people. And it's like what Qatar and Oman, UAE, Kuwait, Saudi have done in the past, that people who don't immunize their children, they don't get the passport, they cannot get registered at schools. So you have to do it. It's mandatory in the Gulf. Therefore, the whole GCC has pushed for that. And in Qatar, maybe we are blessed with one thing. It's a small country, total population is about 3 million registry. So anything is reported immediately and anything is picked up. And we've seen a lot of people with early colon cancer because it's not prevalent. You'll be surprised that among men, lung cancer is quite high. And now liver cancer is also picking up. Among women, of course, like everywhere else, breast cancer, but secondly, thyroid, although we're a peninsula and surrounded by water. So there are successes, but there are still failures. I don't believe that we are at the optimal of this program, but it's been done because whenever you go to take your medication or to do anything, they'll be asked the question, did you do it? And then media has helped us a lot. It's coming, but I'm not happy with it. Personally, I'm not happy with it. Thank you. And I see one gentleman also all the way up there, two of them.
Thank you, Dr. Khalid. Very nice presentation and very impressive colorectal screening program. Would you be able to share with us in the last few decades of work, what is the downstaging or survival looking at in any cancer that you choose to share any information?
Very good question. But you made me look old by saying in the last decades. No problem. No, I think it's only recently we started focusing on the outcomes. In the past, as I said, because less than 40% of diagnosed cases are locals. So we lose 60%. We lose 54, 57% of patients. As I said, some of them, unfortunately, we've seen it. Some of them are working in certain companies. So the employer sees, oh, you have cancer, gives them 2 months' salary, go back to your country. So when they go back to their respective countries, we don't know what's going on. And it's only very few of them that stay, take the treatment and stay in the system. So the numbers are all altered. But I can get you the numbers, Dr. Hadi, we can give the numbers very specific on certain diseases, because in the past few years, we started focusing on Qataris and then non-Qataris. And that made a big difference in the numbers. Otherwise, it's all diluted. And I'll be lying at you if I tell you a number now, but I'm not happy with the numbers. No, honestly, I can sit here and talk and so it's a rosy picture. It's not. It's not.
Right, I noticed that there was a gentleman just now at the back with who wanted to ask a question. You can go ahead. So I hate to disappoint you since you already wanted to ask a question. In return, I will cut short my introduction of the next few speakers so that you can ask this question. So go ahead, please.
I can take from Dr. Wahid time, don't worry.
Thank you. This is Shamim Talukdar from Bangladesh. You already mentioned about the perspective of immigrant people, those who work in Qatar. To give a background that from Bangladesh and some other developing countries, lots of people at the young age, they go to especially in Middle East countries like in Qatar and other Oman and other countries to do the work. And recently in our country, we found that those people work in different Middle East countries or abroad. When they come back, they mostly have a non-communicable diseases, especially cancer, diabetes, and cardiac-related diseases. But after having a young life contribution for the development of the developed countries like you, they come back with a different type of non-communicable diseases. Within our country, there is no services at all. You mentioned that you try to do something for these people, but is it possible to discuss bilaterally with the countries with having a long-term perspective, especially for cancer and non-communicable disease-related healthcare services within the country, to change some sort of policy, as well as to give a long-term collaboration within the country for these people? Thank you.
Well, thank you for the question. I don't run the Ministry of Health anymore, but definitely I think the bilateral relations could happen. A lot of work has been happening recently in a lot of countries. I think we can focus on this and we try to help. If we can help, we'll definitely open up dialogue with the people who are concerned about it. We have the Qatar Fund. I forgot the last name of it. It's called the Qatar Fund. That they actually collaborate with underprivileged countries in building hospitals, schools. Nothing politically attached. Based on numbers of illiterate people and based on number of patients in certain types. We can definitely open that dialogue with them. The QNRF, Qatar National Fund, it's called Qatar National Fund, and they're all over Africa right now building all medical facilities and schools as well. I think there is one gentleman who's been standing there for quite a long time.
Okay, go ahead.
Assalamualaikum warahmatullahi wabarakatuh. In one of the slides, you mentioned you covers everything and everyone. Glad to hear that. But does your Qatar Cancer Society covers refugees, UNHCR card holders? Because in our country, this group of people basically do not have any healthcare services. Thank you.
So let me understand the question. You said something about refugees?
Refugees, yes. Does your Cancer Society covers refugees and give them services?
In Qatar, we don't. We have very little number of refugees that's been covered by the government. But 2 years ago, we were working with Jordan and Lebanon to cover Lebanese children, with cancer, and also Palestinians who can travel to Jordan. We have set the budget, we have arranged all the meetings, and we've done all the setup. And suddenly, 7th of October happens. So we are still at standstill, but definitely we'll help as much as we can. As I said, our budget is not the biggest, but we will not waste any chance to help anybody anywhere. Our only problem is we cannot fund and transfer money outside. So we use the Qatar Red Crescent and we use the Qatar Charity Organization to supervise, and we pick up the tab, as they say.
Great. Thank you very much, Dr. Khalid, and to the audience members for all the questions. May I ask that you stay on the stage, and I will invite Dr. Santori, your token of appreciation, I'm sorry, Dr. Santori again to present the token of appreciation to His Excellency Sheikh Dr. Khalid